Good morning, everyone, and welcome to the first Children's Cancer Cause webinar of 2021. I'm Julie Taylor, and I'll be your moderator today. Today's program is focused on previewing childhood cancer policy for the 117th Congress. We'll share a bit about Children's Cause mission and be joined by Sera Alptekin and Sue Emmer, who have extensive knowledge of today's topic and will share their expertise on what to expect over the coming months. Before we get started, I just wanted to go over a couple of housekeeping things. If you need technical assistance during the webinar, either use the chat feature on your screen, which should be on the right of your screen, or dial 202-487-3270. Today's call is going to be being recorded, and will be available on our website afterwards at www.childrenscancercause.org. During the webinar, everybody will be on mute, but we encourage questions and hope you'll submit them at the end after our two speakers. And you can do so by using the chat feature, again, which is on the right of your screen. At the end of the webinar, you'll be automatically redirected to the post-webinar survey. So please take a few minutes to complete the survey because we really value your input. Next slide, please. Children's Cancer Cause mission is focused on national advocacy for childhood cancer issues, which includes research funding, accelerating the development of new treatments for pediatric cancers, improving regulatory policies at FDA and other agencies, and training advocates through our Kids Action Network, as well as working with our advocates to address state coverage issues, and finally for providing support for survivors. Next slide. Why is childhood cancer survivorship important? One of the great challenges in the childhood cancer experience has been the transition to non-oncology care and long-term follow-up. And Children's Cause is working on several initiatives to address this issue, which I'll describe here momentarily. And then Sue will talk in more detail about our policy and advocacy efforts during her presentation. The reasons we focus so intently on survivorship issues is because there are growing numbers of them, and they all face serious health risks, as I'm sure you all are well aware. And you're also probably very familiar with some of the statistics or information on this slide, but I just wanted to highlight a couple. The first being that there are more than 500,000 childhood cancer survivors, and over 95% of survivors will have a significant health-related issue by the time they're 45, which can range from moderate to severe and chronic. As part of our survivorship efforts, we've established several incentive awards recognizing and encouraging research and programs for those impacted by pediatric cancer. And this slide I'll just run through what those programs are. The Rosen Award recognizes outstanding leadership in pediatric cancer advocacy and medical and survivorship research. The College Scholars Program awards scholarships to childhood cancer survivors for their post-secondary education. We're currently accepting applications for our 2021 scholarship program, so we encourage you to check that out on our website and share with anyone you think might be eligible. The Survivorship Champions Prize is a new one. We just awarded our first prize last year, and is given to a group, program, or institution making significant advances in programs and services to provide lifelong health maintenance for survivors of pediatric cancers. Another component of our survivorship efforts, which is under the umbrella of the Stewart Survivorship Initiative, is a website that provides a variety of resources from trusted organizations to address the needs and concerns of survivors of pediatric cancers. Our goal is to raise awareness about the wealth of information and existing services that are available to survivors to help them on their journey. So now to the main portion of today's program. We're pleased to have two policy experts with us. First to speak will be Sera Alptekin, Legislative Assistant to Representative Jackie Speier, California. She works in her Washington, D.C. office. She covers a legislative portfolio that includes transportation and infrastructure, disaster preparedness, small business issues, agriculture, and healthcare, including the Congresswoman's work on the Biomedical Research Caucus and the Childhood Cancer Caucus. Previously, she worked in Representative Speier's district office as a caseworker and field representative. Sera holds a degree in political science and government from the University of California, Berkeley. Sera will provide a general overview and plans for the 117th Congress, as well as discuss the priorities for Representative Speier. And then after Sera, we will hear from Sue Emmer from Emmer Consulting, and she is Children's Cause Policy Consultant. Sue has worked at the forefront of healthcare policy for over 30 years in both the public and private sector. Sue will provide an overview of pediatric cancer policy during these unusual times and highlight children's cause policy priorities. So I'll turn it over to Sera now.
Great, thanks so much, Julie. So I'm Sera Alptekin. I work for Congresswoman Jackie Speier, who's one of the co-chairs of the Childhood Cancer Caucus. She's worked on these issues for several years now. I know it's something she's really, really passionate about. So I'm really excited to support her efforts on this. As Julie mentioned, I worked in her district office and now in her DC office. So I think that's given an interesting and unique perspective in terms of, how federal priorities and legislation are decided here in DC versus how they actually play out on an individual level and how people actually access the funding and resources or whatever it may be that we are trying to provide. So I thought it would be helpful to go over, what we've accomplished so far as a caucus, what the outlook is for Congress, the general lay of the land. Obviously, there's a lot of differences this year, both in terms of the pandemic, the administration, the makeup of Congress and the Senate. So I think it would be helpful to kind of give a handle on that to see where advocacy efforts would be best directed. So once again this year, the STAR Act was fully funded at $50 million, as was the Childhood Cancer Data Initiative, which is very exciting and definitely something we want to continue on. The Creating Hope reauthorization was also passed by the House last year, which, as I'm sure you all know, incentivizes the pharmaceutical industry to develop treatments for children with rare life-threatening conditions through an extension of the Rare Pediatric Disease Priority Review Voucher Program at the FDA. I think going forward, there are still certain provisions within the STAR Act that haven't been fully followed through and that we just want to make sure, happens in the next year or two. The Agency for Healthcare Research and Quality is currently conducting work to identify best practices to improve the effectiveness of care provided to childhood and adolescent cancer survivors. So when this is complete, we want to coordinate with HHS to begin implementation of this portion of the Act to develop pilot programs and evaluate different model systems of care. Likewise, the HHS Secretary was required to conduct a review of the activities within the agency related to workforce development for healthcare providers who treat pediatric cancer. Within 2 years of the STAR Act being signed into law, HHS did not meet the deadline of June 5th, 2020 due to a lack of funding. So we're going to work with HHS this year, and the caucus wants to coordinate to ensure that the funding we appropriate is made available for this review. So a quick overview of Congress. Democrats have won the Senate, and so we have a 50-50 split margin, which is as razor thin as it can be. It means that bipartisanship is going to be valued more than ever. We've heard that from committees, you know, they're explicitly looking for bipartisan bills. And so as a bipartisan caucus that has always worked really well together, I think it's a huge opportunity for us. And as I'm sure you also all know, appropriations is slowly starting up. The subcommittees have not released their deadlines, but that's something to definitely look out for. There's also a possibility that earmarks might come back. Rosa DeLauro ran on that when she ran for appropriations chair, but there hasn't been any official announcement yet. If that does end up going through, obviously that presents other opportunities for funding specific projects. You know, the main focus of appropriations on our end will of course be to once again get full funding for the STAR Act and CCDI. We'll lead 2 letters, one for that and the other for general DoD programs that support relevant research efforts, as we've done in years past. You know, this is also just a reminder that there's always opportunities for other things within appropriations, especially report language. If there's anything that comes to mind that you think might fit well or that we should be doing more on, this is really the time for science and research and development to shine. So I think there's an appetite for more, you know, funding to research institutions and the like, and we should definitely capitalize on that. You know, another thing to keep in mind is the president's budget. It's always highly valuable to get a high funding level for, you know, certain projects or whatever it might be within the president's budget itself. Eventually, you know, that's going to be that combined with the appropriations request is how the ultimate appropriation bills are decided. Congress obviously doesn't have a direct role in that, but as stakeholders, if you know you have any existing relationships with within the new administration, this would be the time to leverage them and to, you know, bring their attention to the issues that you think are important. It's definitely useful for us. As we saw in past years, President Trump referenced the CCDI in his State of the Union address, and that was, you know, a big step. And I also think with this administration specifically, President Biden has already spoken multiple times and announced, you know, focus on cancer research. I think this really opens the door for childhood cancer issues. I think this administration will be focused on it more than any other probably has in the past, and we should definitely capitalize on that, and that's what the caucus plans to do. There's also going to be several large packages. COVID will definitely be one. There might be a pandemic preparedness one, more future thinking in general, you know, one in terms of pandemics. There's likely going to be an ACA bill that fixes some of the things that Democrats have wanted for a while. It can be difficult to get explicit things for childhood cancer or really any issue in COVID packages because bipartisanship is so important. The funding is going to be really tight and clearly allocated, but that doesn't mean that there won't be opportunities and that we shouldn't, you know, try. We could increase overall NIH funding and the like. And I think another term that I'm sure you've heard a lot recently is budget reconciliation, which is likely going to be how we pass a lot of these packages. I'll briefly go over it just because it might not be something that, you know, everyone is aware of, but the House and Senate must pass a budget resolution by a simple majority with reconciliation instructions for relevant committees that have to do only with spending, revenue, or debt. So that's the catch there. So we won't be able to pass, you know, everything in the COVID package that President Biden has put forth through budget reconciliation, but possibly a good amount. The benefit of that process is that it allows us to avoid the 60 vote cloture threshold to limit debate in the Senate. But legislation must be really narrowly tailored to abide by the Senate's specific rules regarding budgetary matters. Budget resolutions can also have windows that are longer than the fiscal year that they're just in. It can be 10 years down the line, for example. Each BR can spawn 3 bills, focusing each on spending, revenue, or debt. That can be how it's decided, or it can be one large package, but that might help explain, if you've been hearing media reports that 6 bills are possible next year for the reconciliation process. That would be in part because we did not pass a budget for fiscal year 21. So technically we can pass one now by September 30th, 2021. Then we can also pass a fiscal year 22 budget by September 30th, 2022. I'm not sure like when or how or if they would use that second potential BR, but we're already in the process of formulating the first. This week, the committees are releasing their respective bills for the budget reconciliation and essentially like what they want to focus on and what they've like authorized and appropriated funding for. The markups are happening all throughout the week. So some have already been released, some have not. There's multiple per day. If you're interested, you could go to each committee's website and it'll, list whether the markup has already happened. It'll have a video of it. It'll have like the legislative text if that's of interest. So what are the caucus's priorities and what are Congresswoman Speier's priorities? I will say that as a whole, all of our regular work in Congress has been delayed due to the pandemic, which has been the focus, will continue to be the focus likely for a while until probably we get through the winter would be my guess at the very least. For that reason, the priorities that we would probably normally have clearly established by now haven't been set as much just because there's just hasn't been an opportunity to sit down and really brainstorm in the same way that we would. But at the same time, I think it's been helpful for offices because we have more time to hear from stakeholders on issues, more time to develop them when we're not working on COVID. So if there's anything you want to bring to the caucus's attention, any meetings you want to set up, this is the time to do so, and it's very helpful for us. I think what Congresswoman Speier will generally focus on, one topic would be priorities that are in tandem with the pandemic. So we know that the pandemic has exacerbated and shed light on a lot of existing disparities and problems within the healthcare system. So we're going to be focused on, funding and initiatives to help address those concerns. Another big one that I know she wants to work more on this year is mental health, both in terms of support and awareness and funding. The COVID packages have included some mental health funding, but I think there's an agreement that we need a lot more, especially given the residual effects of the pandemic that are likely to, linger for a while. I think continuation of clinical trials and research outside of COVID. There's kind of been a pause in some sense on a lot of other healthcare initiatives or research just because of COVID. Labs and doctors and researchers are being told unless it's COVID focused, we'll put a hold on things for safety concerns. Obviously that completely makes sense, but we want to make sure as we kind of move through the pandemic that labs and researchers are getting the support that they need to continue their work as much as they can and as soon as they can, so that we don't get so behind on every other healthcare issue that needs attention. Similar issues with medical care. I've heard from patients and groups both that they've had no issues accessing care and others that absolutely have. So Congresswoman Speier is going to focus on making sure that everyone who needs it can access care and that healthcare providers and hospitals have the resources they need to meet those needs. We're going to continue the administration's focus on health disparities. As I mentioned before, I think there's a push for greater accessibility, affordability, and also culturally sensitive care, reaching communities in rural areas, increasing broadband because telehealth has become so common, and almost certainly will be here to stay. It's been extremely popular. And workforce development is another major one. It's something that's brought up in the, in the STAR Act that we're working on, but I think there's also a huge push from the Biden administration, as we've seen in their executive orders, in their own plans and announcements. It's going to be a major focus for the next couple months, and I think there's, that's the time to also push for workforce development as it relates to childhood cancer. And finally, the last one that's like a bit less directly related, but we've heard from several nonprofits or supporting organizations that the pandemic has also just hit them really hard, and some have qualified for SBA assistance like PPP and others have not. But at the same time, there's no doubt how important they are in terms of overall care and resources and support, and we want to make sure they can get through this pandemic. Many of them fund research and provide grants that might not be available now because tightening has been funded. Funding has been tightened, and the ability to fundraise has become obviously very different in this setting. So any form of support financially that we can provide there to ensure that there isn't a breakup in support during this time will be another major focus of ours. I already mentioned this other point, but we're also going to see what other items that have come about during this, like telehealth, can be carried over, that are popular, that are helpful, that we now have set up some infrastructure for and could continue to grow. This is one area where it would be really helpful to hear from stakeholders and anyone who's had experiences with a change in the way healthcare is delivered that they think is either positive or negative that we should look at once we come out of the pandemic. And so the next, I think, big priority for the caucus will be preparing for the STAR Act 2.0. The original STAR Act has a 5-year authorization, so the next STAR Act can be introduced as early as January 2022, which means we start preparing now. Certain aspects of the original STAR Act have already been completed, which means we have an opportunity to look for new measures to be included, for new ways for the funding to be attributed. So I think the research and talks around that are already beginning and will continue. One way we could do that, for example, is to go off of the GAO report that was authorized in the original STAR Act. I know our office has already had some discussions, for example, at how we could develop a childhood cancer code for insurance companies. I realize that wasn't, I believe, an explicit recommendation from the GAO report, but it's something that we've heard there's a great need for. And while groups have offered to do all the work, and do the research themselves, that's also why our office is here. And so we'll definitely be using all the resources available to a congressional office to look into those things as well. And we're always happy to for all issues. We're a resource for you all. And finally, specifically for Congresswoman Speier, her focus has always been on survivorship. Back in 2013, we had introduced a survivorship bill known as the Childhood Cancer Survivors Quality of Life Act. Many provisions of it were included in the STAR Act, so we haven't introduced it as a standalone since then, I believe, actually. But we're going to be revisiting that bill to see what sections of it weren't included, whether it makes sense to include now, whether they would need updating. Maybe these are things we consider for STAR Act 2.0. But I think, Rep. Speier really wants to get back to that focus and see what our office specifically can do to move the needle. So I know I just spoke a lot, but there's a lot to cover now. There's a lot of opportunity in this new Congress. I think that's a double-edged sword in certain ways. There's so many crises that need immediate attention, the pandemic just being one. So the reality is that offices, in a sense, are swamped, but at the same time, that gives us so much opportunity to move forward on issues that we haven't maybe been able to make as much headway as we would have liked to in the past several years. The more specific information we get from stakeholders, the more helpful it is for us. I think, the focus will be on the priorities that we've always pushed for, the funding that we've always pushed for, while also looking for any new opportunities to insert things here and there that can support childhood cancer efforts. So it's very exciting. I think we're really excited to get to work and to just roll up our sleeves and hopefully do some good work. And I think we're going to save the questions for the end, but thank you all so much for having me, and I look forward to working with all of you.
Thank you so much, Sarah. Now I'll turn it over to Sue to talk about children's cause priorities.
Thank you, Sarah. That was really informative. I learned a lot, and we're very excited both to work with you and the caucus this year. And of all the points you said, I just want to reiterate that we very much believe, I think as the community does, that our issues are bipartisan, and it's been a really important sort of foundational component of the work we've done, and I think it's made us all stronger. So I am going to focus on the children's cancer cause priorities. Julie laid out many of them and did a nice job. What I want to note, however, is that we work on all these issues often as part of coalitions or with other partners and stakeholders, but they're really two issues that we have a very long-term focus on and track record in. And I'm going to focus my presentation on those areas. And those are the areas of survivorship and drug development. And you heard a good bit about the survivorship issue already. I'll probably go into even more detail about our agenda and what we've been doing and hope to do in that area. We're really a leader in this area. We worked with Congresswoman Speier's office, in fact, on the 2013 legislation and then the STAR Act provisions. And, it's just a priority of our organization. Another area that I'll focus on as well, that we haven't talked about extensively yet, is the area of drug development. And this also is a focus of our organization since its inception. And we most recently were one of the leaders on the RACE Act, which modified the Pediatric Research Equity Act in PDUFA 6. And that eliminated some exemptions that have hindered the development of childhood cancer therapy. There's still a lot more to do in this area. We're not where we need to be, and I'll talk further about this as well from a legislative perspective. So moving on to the next slide, I'm going to talk now about the survivorship issue and really tell you about our multi-pronged agenda in this area. So, one of the things we're doing, going back to the STAR Act, there's one major provision in STAR that was not included in the end, and I think there are many reasons for that. There were a number of survivorship provisions that went through, which was a wonderful and a huge accomplishment. There were some jurisdictional issues and others, but one of the things that we've been working on is this whole issue of a standard of care. The issues around coding are wrapped up into this, but the sort of bottom line issue here is that there's a very uneven experience that childhood cancer survivors have when they leave their oncology care and they go out into primary care. And whether they go to a pediatrician or they're a young adult and they're with an internist or family practitioner, very often the handoff varies very much, and even when there is some survivorship that happens in that, and you all know this, I think I'm speaking to some very educated folks, there's not a lot of consistency to the various pieces of it, and whether there's a summary of care, recommendations for future care, and how much that's provided to the patient, their family, and providers. So building on the GAO report, which Sera mentioned, and I think was a really good sort of high level look at where some of the barriers are and the work that's been done. We do think we need more push in this area for this kind of both standard of care and coverage, because without coverage or payment for something, especially as complicated and labor intensive as this, it's something that is probably not going to happen. So what we've done as an organization over the last couple of years is a lot of research. We've talked to over 20 stakeholders in very extensive interviews. We've done a lot of research on the existing literature, and concluded that there is, in this arena, the pediatric one in particular, there really needs to be more infrastructure to catalyze this forward. So while there's no perfect solution, what we've been looking at, and we think the best way to probably do this right now, is to get authorization of a Medicaid demonstration program in this area. So to look at different models that exist or incentivize new ones through the Center for Medicare and Medicaid Services demonstration program model, and then ultimately use that to come up with some recommendations. We think this would really build off the STAR Act provisions that we've heard about already. There's a lot of great work, in particular that the Agency for Healthcare Research and Quality is doing right now, come up with some best practices and focusing really on existing literature. And we think that's great and will really give us the backdrop for this. Important point to make here is that this is not something that requires legislation, although Congress does often end up authorizing pilot or demonstration programs just to, show their interest and sometimes actually ultimately require this to be done. So I think it is something that's very much worthy of legislation. And I think the coding issue that Sera brought up also could be wrapped into this as well. It's an important piece of it. And I won't go into the weeds on it, except to say it's just a little more complicated to develop a code for our population because, Medicare isn't where we're going. That's obviously for older people. And so there's not as much the clear overall federal footprint on Medicaid in quite the same way. So it's something where we're always eager for new and innovative ways to do this and open if there's ultimately a different or better way. But we think as part of STAR 2.0, which I'll talk about in a minute, but also just even separate from that, this is such an important issue where we really haven't moved as far along as we should since the seminal reporting back in maybe 2006 from the IOM, and that we really need more legislation. So we're actively working on that this Congress. Building off that, I think I said already that this is something that could be done administratively. So we've spent a lot of time as an organization trying to understand the current arena, what's happening already, and would there be an appetite to do this from whole cloth? We met with the Center for Medicare and Medicaid Innovation on this issue last year, and we're pleased even amidst COVID they were able to do that, and had a great discussion and found some folks who already really understood the issue. It's a small population, so not surprisingly they weren't prepared to immediately start a demo, and honestly we didn't expect that. But one of the things that we heard as part of that conversation, and we had thought about amongst ourselves already, was the Center for Medicare Medicaid Innovation agency or under CMS has already done a lot of great work, including the oncology care model and oncology care first, which is being implemented. And those do have survivorship provisions. And was there a means or mechanism, particularly with this new oncology care first model, to embed some of these Medicaid issues? And what we heard from the folks we talked to is they've thought about this already. And you could see some of that in some of the materials they had put out. and they would be open to working with a state, no commitments, but at least open to working with a state that was interested and available through their Medicaid program to do some of this. I think it's a hard ask, especially in COVID, where state budgets are strapped, and Medicaid programs as well. But we think this is an exciting opportunity, and we've been involved in the very slow process of talking to stakeholders across the country, learning more about state programs, and trying to see if we couldn't generate some interest at the state level on this. So if this is an area where any of you listening have any particular insights, interest, or ideas, we'd love to hear from you, and we'd love to partner with you. It's going to be a slow process, but we do think it could be an incredible opportunity and a way to meet some of the goals we've talked about earlier. Another item we're working on, and it's already been referenced, Sarah did a wonderful job presenting the STAR 2.0, and we, as I've said already, we do a lot of our work through various coalitions. And one of our key ones is the Alliance for Childhood Cancer, where we're working with a lot of our peer organizations. And we're one of the leads, probably the lead on this survivorship issue. And consequently, we are chairing a task force in this area to look specifically at STAR 2.0 and what might be appropriate survivorship provisions for that legislation that build on the prior provisions of STAR, or maybe, as was mentioned earlier, get at some of the areas that we weren't able to. And we have a couple ideas, including this issue of a code, which has come up a lot, and probably, structurally has some issues, but it's a really important piece of the conversation. And, looking at some other provisions of STAR that could be included in 2.0. So we're very excited about that consensus project, and we've had probably 4 conversations with a subgroup of the Alliance. We're looking at early draft materials, and again, I think it's a really important effort to be working on in a consensus-based way. And then last, I've kind of jumped around here, but I'm going to go back to something that Sarah mentioned, and that is some of the great provisions of STAR, and particularly the best practices work that the agency, that ARC, is doing. And we have commented on those. We've been in touch with them, our founders participating in some of their groups. And, we think that is a wonderful roadmap and way to help frame and, pull out the existing work that's been done in this area that we can really build on in the future. So we're really excited that some of the STAR money has gone to funding that effort. I think there are 3 different ARC projects, but they're ongoing, and they're really important. So that's a snapshot of the work that we're doing as an organization in this area, and we think it's a really, really exciting time for this issue. So moving on to the next slide, I'm going to talk about a different issue, and that is our drug development agenda. And it's not something that we've had as much introduction from our earlier speakers, but as I said, when I started, this is really one of the main areas where we've worked since our organization started. So just to give you a little primer on this, a lot of the work in this area happens in the context of something called PDUFA. And this is the Prescription Drug User Fee Act, and it's something that has to be reauthorized every 5 years. In other words, it has to come before Congress, and the sort of framework has to be put out there. And so it's really important to bring up because it's an opportunity in that it was last renewed in 2017, and so it will presumably be reauthorized. PDUFA 7 will come up this Congress next year. And so there is a lot of work that I'm sure organizations all over town are doing to prepare for that. It's often a very comprehensive process that deals with many, many, many different issues. As I'm sure most of you know, our community worked on the RACE Act, and we were heavily involved conceptually creating those ideas. And we are in the process right now of developing an agenda for this reauthorization. And we're really in the weeds on it. It's a very technical area, so we're trying hard to look at, you know, what's in race, how is the Race Act been implemented. That really was, it's something I mentioned earlier, but that was really major legislation that we passed in the childhood cancer arena and drug development, looking at things like early advice and, you know, what have been the barriers out there, and looking at the sort of stick and carrot approach to, you know, getting more therapies in this area, and really moving away where we can from the organ-based approach to really mirror what's happening in the adult community. This was a great step, but I don't think it's really brought us fully where we need to go. So what we're trying to do is say, what are some existing and new areas that we could put forward in the agenda way. We're looking at some things, as I said, having to do with early advice with sponsors, orphan drugs. Also, one of our new areas is, are there any lessons learned in COVID that that we can apply to this? And so I was really pleased to hear Sarah bring that up. I think it's important part of this. And it's premature at this point for us to share our agenda, but we're really excited about the work we're doing and digging into this Congress as well. So I think what I will do at this point is stop. That's a real high level look at what we've done. I should just mention one other area that's new. I don't have a slide on it, but I think it's important, and that is, you know, we are interested and focused on the issue of COVID and survivors, and we've both did our own letter and signed on to some letters in this area looking at their prioritization as for vaccination. So I will stop there, and we can now move into the question and answer part of the agenda. Thank you. I think Sarah will come back and join me for this. And Julie.
Yes. Hi. Thank you very much, Sue. We'd now like to open it up for questions to the audience. So some of your questions may have been answered during the course of the two presentations, but if you do have additional questions, please use the chat box on your right and type them in. And we'll just take a moment to see if anybody has any questions for Sue or Sarah. Okay, we do have a couple questions, and I will pose these to both of you. The first asks, what can individual states do legislatively for the cause? This writer has noticed that states are required to have comprehensive cancer control plans, yet they're not required to include pediatric cancer. Is there a way we can change this?
I'll jump in on that. You know, we continue to look for opportunities to work on these issues on the state level, and I can't really speak with any great depth on the issue you raise. I think this did come up actually in some of our stakeholder work we did on survivorship, but I think it's something that we'll look at and I can bring to some of our state folks for the future. And I think that in general, the states are a really right place to go because it's, you know, a place where you can be sometimes more innovative, things can happen faster. The state legislatures, you know, work in a different way and pace, and typically constituents can have great access and impact. So to the degree that there are states that have models that you can import, that makes a lot of sense. And even some of the Medicaid things we've brought up, we think could happen at the state level as well. So we'll look back at that again, the issue that you raised specifically. And if you want to reach out to us separate from this, that would be great too.
Yeah, I'll just add that if you haven't already, to absolutely reach out to your state representatives and, you know, see how aware they are, if they're doing anything, if there's an equivalent coalition on the state side. it's a bit more tedious because you'll kind of have to engage each state, but I think it's definitely worth it because to Sue's point, things generally move a lot faster and just more so at the state level.
Thank you. The next question is, how can America partner with other countries, specifically countries that lack resources and high survival rates?
That's a great question. You know, I probably can't answer it as specifically as you'd like. One of the things that we're looking at, and I failed to mention in detail in our drug development, is what are their existing models out there where countries are collaborating. And so there's something in Europe called Accelerate that is really a collaboration consortium model around the whole issue of drug development. It's exciting, and it's something that we've participated in, our founder rather. And so, you know, we're looking at, are there ways to replicate that here, or if not replicate, what are lessons learned and ways that we can try to use our policy and other processes to move that forward.
Yeah, I think it's worth looking at any US AID programs that might exist already that support global health initiatives. I'm not too familiar with things on that level, but the United States has supported, you know, been the most effective in terms of providing funding to institutions or groups on the ground in certain countries that are already trying to do the work but just need more support. I've seen legislation occasionally that, you know, that directs more like a new grant program or more funding to an existing one, and you know, asks that USAID or the State Department collaborate with the CDC and whatnot. But that's generally, I think, the approach that we take.
Thank you. This next question is directed primarily at Sue, and they ask if you could comment more on how you foresee helping sponsors with RACE, the RACE Act. There are likely real and perceived barriers for sponsors and the ability to do this.
So, all right, you know, like I said, we didn't get into a lot of detail because our agenda is still evolving ourselves, and you know, this is a very both technical and political area. So I think what I would say is we very much agree, we absolutely agree with your point that there are still a lot of barriers and problems and issues for sponsors, and so we're trying to really understand, number one, how did the portions of RACE that have passed it, you know, is there anything there that we need to be looking at? And then what are maybe some other areas where there's still work that can be done to make it better for sponsors? I think we're probably going to be more able over the coming months to give more details in this area about what we're thinking, but we're really trying to make sure that we have it right technically before we jump out. So we're looking at, I think I've touched on the areas. I talked about the international collaboration. I talked about the early advice process. We talked about looking to see if there's any models within COVID. There I think are one or two other areas we're looking at as well.
Okay, thank you. The next one I think is for both of you. This person asks, how can we as founders or executive directors of organizations get involved in lobbying this year or helping with these various pieces of legislation?
I mean, I think, you know, do what you've generally done sooner rather than later, just as early as you can. I think get that initial meeting and get it on the book, so to speak, and keep at it. I think multiple meetings are okay as we get closer to maybe a package going through or whatnot. It's obviously a little different, I guess, with COVID and the context, but especially if you're able to, as Sue mentioned, form a coalition, I think that's really effective and shows offices that there's, you know, broad support makes our job easier and therefore, more likely to be able to push things through. But yeah.
I agree. I think that our work has been very successful when we do it as a coalition, and so we try whenever we can to do that. And I think for our issues, the Alliance for Childhood Cancer has been the best means to do that. So, I would encourage you, if you don't already, to work through them, bring issues to the policy committee if they're not there. And then when you hear of certain things like, what work we're doing in survivorship that we may be hoping to do with the Alliance, but maybe we're not there yet, reach out to us directly. I think working, going to the Hill as a couple stakeholders together, even if you're not the full Alliance, is a very powerful way to do it. It's something we would really welcome. It can show some broad support. So, reach out to us or others where there may be an identified area priority that you already agree on. And, one thing I found working virtually with Congress over the last year, once everyone got their sea legs, which it took a while, people are really responsive. And, one of the benefits I think of virtual is you can get people materials out. They've often read them before the meeting. So I found it a very collaborative, constructive process too.
Sarah, did you have anything to add about what advice you would give people to on their lobbying efforts or what they can do?
I would just say the more clear and concise your asks are, the better it is. Don't shy away from just saying this is what we would like, because that's what we want to be able to give. But we have hundreds of lobbying meetings like during our time, and it helps it stick in people's minds, frankly, if you're just like boom, 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 1, 2, 3, this is what we need from you and this is why. I think sometimes people dance around it because they want to be polite, and it's understandable, but at least in my experience, that's been the most helpful for me, followed up with, as Sue mentions, an email of exactly those things.
Thank you.
Short meetings are good meetings, right?
We have time. We have just a couple more questions in the queue, which we should be able to get to both of those. The first is, what is the discussion on preventing childhood cancers? Are there plans to step back and look at root causes for the increases in childhood cancer over the past couple decades?
I don't have much to add. There are probably others that are part of our organization or, our leadership that would even be able to add to it. I think this is a really important issue. And I think, probably with the focus of the Biden administration and looking at, moonshot and other areas, that it's something that should be on the agenda, or probably can be, but it's not something that we or I've focused on for Children's Cause.
Yeah, I'll just add, I think Rep. Speier's focus has been on survivorship, but it's a equally important issue to definitely discuss, and it's something that I can absolutely bring up at our next caucus meeting and, see if any other offices have ideas or thoughts around it.
Thank you. Our final question for today is primarily for Sue, and they ask how your work, Sue, the things that you described, relate to the Stewart Family Survivorship Initiative.
That's a great question. The Stewart Initiative is a really exciting endeavor that we've taken on, and Julie is heavily involved in. And I think what it gives us is a sort of, I don't want to call it necessarily an internal mechanism, but a way to really dig into some of these issues and do more research, understand real world applications in a way that I'm, not able to in my policy work. So it truly gives us more bandwidth, and I think it's still relatively new, so and Julie probably can answer this better than I, but I think there's a lot of partnering that we're going to be doing through the two programs because I think they both support each other.
Absolutely. Well, we have time for one more question that just came in, and that is asking about the Gabriella Miller Kids First Research Act that was signed into law in 2014, and they've been given appropriations over the last 7 years. And the 2.0 version of that bill was just introduced, which currently has 22 co-sponsors. I guess this question is directed more to you, Sera, about have you had an opportunity to look at this bill yet and determine whether you're going to be supporting it?
Yeah, so I've connected with, the staffer in Rep. Wexton's office who introduced the legislation, and she indicated the changes. As a staff member, I recommend that we sign on to it again. But like everything with COVID, the request goes up the chain, and we just haven't been able to get responses as quickly as we normally would, especially with impeachment and the budget reconciliation happening now. So I know it's frustrating to not be able to hear back from us as quickly as we might have in the past, but I would just, urge patience. We're trying our best. We definitely usually get through the information faster than we're able to have like a final decision on it, if that makes sense, just because it takes time to have every person that needs to look at it. But it's on the top of our list in terms of childhood cancer issues, definitely.
Thank you so much. So I just want to, that concludes our webinar for the day, and I just want to thank both Sera and Sue for sharing their time and their expertise with us. We just ask in closing that you take a few minutes to complete the post-webinar survey. You'll get a notification and be automatically directed to that, and we really value your feedback on that. So thanks again to everybody for participating, and we truly appreciate your continued interest and support for what is our collective mission, and that is curing childhood cancer and ensuring that survivors have a long and healthy life. So with that, I thank you all again and wish you all a good day.
Thanks.
Bye.